Good afternoon, everyone. Welcome to the King County Continuum of Care Regional Homeless Authority Advisory Committee meeting, special meeting. Today's date is November 16th, 2022. The time now is 2:04. Thank you for joining us. If Christy has joined us, I'd like to start with a land acknowledgement.
Hola, mi nombre es Christy Hamilton. I am an American Indian, Salish, Kootenai, and Assiniboine. I'm a member of the Continuum of Care, also a member of the advisory board and co-chair of the System Performance Committee along with Tamara Bauman. I'm here in the land of the Azteca people, that is Puerto Vallarta, Mexico. I'm grateful to be allowed to be on their land, to live their culture, to be involved in their tradition, as all of you are on the land of the Duwamish, the people that have settled the area in Seattle and around Seattle for more than 11,000 years. They're currently fighting with the government to become a recognized tribe. It is important that we as a group and as a Native group and as a government group acknowledge these people, their ancestors, their forebears, and the people will come after, that we're doing a very important job in creating housing equity wherever we go. This is National Indigenous and Native American History Month, and I'm honored to be here among my esteemed colleagues. And I say in my language, thank you.
Thank you. Shanae, will you take us over a plan for our public session today?
Thank you. Shanae Colston, co-chair of the COC board. Today, we will get a presentation in regards to the 5-year plan. I'll be honest, I'm kind of anxious of what that's going to look like, as the plan seems to change depending on who's giving it and who it's presented to. The second is we'll be voting today on the applications, forms themselves, the documents. There's a total of 2 applications, but one will be used in 2 capacities. The first is the System Performance Committee. Tamara and Christina have put that together. At last meeting, some of us had a chance to not review it and review it now. And so I myself am in agreement with that. And then the other application process is to fill our seats currently that are open here at the COC board. And then as well as when we are revising the CEA PACT Advisory Committee, we'll be using that application for that as well. So we'd like to vote on the approval of those so that they could be posted to the website, and that we would hope to start interviews and accepting applications at the beginning of the year.
Thank you. Catherine, will you give us a roll call?
Will do. Tamara Bauman.
Here.
Thank you. Reverend Dr. Kelly Brown.
Here.
Jenna Burgoyne. Lise.
Jenna has apparently tried to officially resign from the board, but they don't know if there's like more of a process that they need to take. But I guess that they sent out an email. Yeah, so Jenna is no longer on the board, but I, Lise Castro, am present.
Thank you, Lise. Shanae Colston.
I'm sorry, can you repeat that?
Shanae Colston.
Here.
Thank you. Brianna Franco. Marvin Futrell.
Here.
Christy Hamilton.
I am present.
Thank you. Marisol Tapia Hopper. Benjamin Misk. Noreen Hill Oneida. Linda Peoples. Christina Sawicki. Robin Tasuda. Karen Taylor.
Just an FYI on Noreen Hill. She is on sabbatical until the first of the year.
Thank you.
Thank you. Sherry Tillman.
Here.
Have I missed anyone? Based on roll call, we have 7 members present and quorum is not met.
Is quorum not met with the, now the inclusion that we've had one person resign from the board?
So with that, we still need one more member.
Okay, keep us, let us know if we reach that threshold.
I will keep an eye out for that.
Thank you. Thank you for all the board members who've chosen to work with us today. Before we dive into the work, I'd like to start off public comment or open up public comment. The caveat is always that we will, while we start with public comment, if folks join us later or have questions, please let us know. We will keep public comment open until the end of the meeting. Do we have anyone in the gallery at present?
We do. Benjamin Schroeder, if I said that correctly. Put in the chat message that they are from BA CPC AAC Forensic Path Team Community House Mental Health Agency, along with an address and telephone number stating he'll volunteer. So I have all the information. I'll go ahead and forward that information to you chairs. And at the present, just to get clarification, I have turned Ben's microphone on.
Hi,
Hi, Ben.
this is my first meeting, so I'm
Welcome.
checking in and it's good to be here and I came to learn and maybe even become involved if that works out. I as someone that is involved with a team that does intensive outreach, I certainly have a perspective about the playing field and where there's barriers and things like that. And I'm hoping that somehow I can take that body of knowledge and use it to help make things better. So I like just the concept of continuum of care is something that I try and address. It has a slightly different meaning from my perspective. The actual continuum of care, I think, but then again, that's why I'm here to learn. So thank you for having me.
Welcome, and thank you for checking in. Catherine, do we have any others?
This time, there are no more public commenters.
Okay. Let us know if anyone else joins or wishes to make public comment. With that, I'd like to hand the meeting
One
over.
moment.
Oh,
I'm sorry. I'd like to acknowledge Karen Taylor joining the meeting, which
Yeah.
puts us at quorum.
Thank you very much. Welcome, Karen. So at this point, I'll pass the baton over to Jeff Sims, And we'll move into the 5-year planning workshop.
Hey, Marvin,
Hey,
this is Karen.
hey,
And
Karen.
what I want to say
Hey,
is that I
Karen.
don't want to hear that, what they finna read. So I'm not listening. But I mean, if they want me to vote on something, my vote is no. Because I don't understand and I don't have relationship with none of those people. Okay, so my vote is no.
So we're not at the voting part, and the part of the voting that we will be asking is in regards to the applications, and when we get there, we'll explain that.
I'm not walking through that. I'm not doing
Okay,
it.
thank you.
You guys can vote me off this board is what you can do. Because the community ain't seeing none of that money. I'm sitting here with a community member right now who don't have no place to stay and been outside for the last year, okay? And they don't see that money, that 50 million that you want me to vote on, they don't see it.
Understood. So can we mute so we can continue with the meeting?
Do you want me to go, Marvin, or did you want to say more?
No, I wanted to make sure Catherine was able to manage so that we will have space to hear about the 5-year plan, which is up next. That's you.
Okay. I'm going to put my screen back up so you can all see. You should be able to see the slides now. Is it large enough for everyone? Is it adequate? Marvin, could you tell me, does it look like it's okay?
Well, since I'm
Yeah,
on,
fine.
yes.
Thanks, Janae. So my name is Jeff Sims. I use he, him pronouns. I'm the Senior Director for Policy at RHA. I was with you a couple of weeks ago to talk about the 5-year plan and our process for drafting it. Last time we talked a lot about some cost modeling that went underneath, that underlies some pieces of the plan. We also walked through the goals, objectives, and initiatives that have been formulated. Both of those pieces have had a substantial amount of engagement from people in this group, as well as other members of Lived Experience Coalition. So I know that was, and for many of you, it wasn't new material. Today, some of it might be a little bit more new though, because we are in the process of trying to develop the metrics that would need to go with the plan. And we really hope that we can get the engagement from you all on if you think we're looking at the right things here. I can say that these are very, we wanted to get started with something so that people could react to it rather than being asked unfairly to just chime in without any grounding. But there is a lot of room for edits and changes here. And they really are. In fact, I personally today saw like some changes that were like, I don't think this is actionable. We couldn't actually measure this thing. So there is a desire to really get your honest feedback on some of these. So I'm going to spend about, we have about an hour total for this presentation walking through that. And I think that's the primary place that the group wanted me to focus on today. And then the last section that I'll go through highlights the models, the housing models that we talked about last time. There was 8 permanent housing models, and talks about the cost assumptions so far that would underlie those, because ultimately if we're going to highlight a large scale need for additional housing, we would need to have a sense of what that would cost and be able to message that as part of the plan. Knowing that it is RHA's job, it's in our founding documents, to be advocating for that and working with other systems to make that happen, but that many of the things, and as we talked about during our last meeting, many of those items are not under the direct jurisdiction of RHA. So I'll go into the first part here. And also all of you should have this. These are the materials that Catherine provided in advance. I purposely structured the slides so you could look at, they're color coded, or so you can see these first ones are blue, for example. And I intended for us to just go through them and give you a chance to walk through and provide insights on changes you would make, or if you feel like we're on the right path, things like that. There's 6 groupings overall. The first slide here that you can see where it says systems at goal 1, it has 1-A, and you can see it just labels what the metric, what the goal is with each of the objectives. And then in the next slide, which is still in the same color, it notes that we're in the evaluation metrics, and then they match. So grow and diversify the portfolio of service providers. And now what's a metric we would use to demonstrate accomplishment of that? It'd be a percentage increase in the ratio of providers that serve disproportionately impacted populations. So that's how all of these will work, will roll up. I'll go through them, but please feel free to chime in at any time on the goal that we're in, if there's one that you wanted to focus on more or talk about more. But I thought that the most effective way would actually be to just be working through each of them at a time and hear people's feedback. From Marvin and Sinead, does that sound like an okay approach?
Yeah, that works best, right? There may be literacy moments, so please allow space if somebody does want to comment or question. They might not be familiar with the wording or the structures, and so just being aware of that. Thank you.
Absolutely. And actually, Sinead, thank you for highlighting that. That is something that separately we've heard as a concern, is that there's times in some of these that it's jargon that's being used and not a plain language kind of summary for individuals. And so there's a recognition that that needs to be corrected as well. So certainly, like, to the degree something might need to be a little bit more clarified, I'm happy to do that as well.
Thank you.
Yeah.
Also, just for public reference, these materials are located on the KCRHA website and have been posted. They were also emailed out to all members of this board for review. If you did not have time, that's what he's here for today, is to go over it piece by piece with you. And so we look forward to engaging in this conversation and collaborating solution-focused responses. Thank you.
Thank you for that, Sinead. So on the first one then, we are talking about system goal 1. And there's 7 objectives underneath that. We've laid those out before. There wasn't a lot of feedback about the objectives, but if that comes up as a result of talking about metrics, we'd welcome that input as well. Around growing and diversifying the portfolio of service providers, this is one I already read. The metric we think we'd apply to that is looking at the percentage increase in the ratio of providers that serve disproportionately impacted populations. So out of our full scale or full range of all providers that are listed, by, for, and equity-focused organizations, being a greater percentage of the organizations that are funded there. On the next one, increase public funding for services. It would just be a percentage change in how much funding we receive from federal, state, and local sources. Basically, like, did we get more money or not? On C, increase philanthropic funding for homeless services. Again, it's the same type of a metric. How much change in funding over time there was, with a focus on whether it's one-time, ongoing, time-limited, things like that. On D, standardize and support the increased practice of person-centered, healing-based approaches for homelessness services providers. So this is a little bit more focused on the support provided to agencies to make sure that you have a person-centered, healing-based kind of focus with how services are delivered. I know that's something that everyone on this board has probably been a strong advocate for already, and really has expressed to us the need to have that focus. And then the metric we're looking at is the number of providers that receive those trainings, and then looking at before and after, the ability to either reflect a competency or a focus on that. Because this was focused on to achieve some of those practices in our providers, we're going to have to, as RHA, actually teach that kind of curriculum. And I also should note, I can't, when I have my screen shared, I can only see 1 or 2 people's photos at a time, and I can't see if hands are raised. So if I could get help in knowing if I miss anyone.
Jeff, I'm watching that for you.
Perfect, thank you, Catherine. I just don't want to miss someone and talk over anybody. Let's see, 1E is stabilizing frontline staff workforce at homeless services agencies. And we would measure that by looking at the number of years at an organization, the number of vacancies, so like turnover, then and number of vacancies overall, as measuring, are we stabilizing the workforce? Do people have more longevity at where they're at? 1F is increased capacity building support for agencies that are positioned to provide culturally aware and responsive care. That is quite a mouthful. So, but the support for culturally aware and responsive services. And then the number of years at an organization over time. Oops, sorry, I'm looking at the wrong one. The number of providers, again, that receive that training, and the assessments of, like, is it happening before and afterwards? And then also looking at the the portfolio that's held by provider organizations that are offering services that are culturally tailored and to serving certain populations. And then the last one in this overall goal, and then I'll stop and just make sure people can ask any questions and have space, is developing capacity for a severe weather emergency planning and response that meets the needs of people experiencing homelessness. So here it's really developing capacity to respond to severe weather incidents. And that's heat, smoke, snow, cold, things like that. And we think we'd measure this through after action reports. For example, over the summer when we had a heat emergency, we looked at the utilization of those and saw that certain programs are cooling tents. We're getting much more response and usage than cooling centers that were not necessarily located near where people were at. Would have to be traveled to, you'd have to leave your stuff behind and get there and go through all of that work just to get to a place to cool off. And so that helped us recognize, yes, we are developing a response that is that meets the needs of the people that actually would utilize the services. So that's all of system goal 1. I want to pause and allow for any comments, or just like see if anybody wanted to ask clarification. I know sometimes it's hard to jump in when we're all online.
I do not see any hands.
Perfect. The next one then would be system goal 2 is to reduce racial disproportionalities in homelessness. 2A, ensure equity in service provision. How would we measure that? The completion of stated initiatives under the objective. So there's last time I provided a big grid that showed all of the initiatives that underlie each of these objectives. So if those are all completed, that many of them were one time, like this is a done or not done task, that would be one aspect. And then also looking at service type and racial disproportionalities in those. And then also looking at data from the Office of the Ombuds. So that could potentially be, I think that this needs a little more, again, these are very drafts. So we are really looking for feedback, but it might be a question of how many concerns are expressed, but then we have to think, well, what's good, what's bad? Do we want more investigations? Is that a sign that the Ombuds is doing its job and catching where bad practices are occurring? Or do we want fewer requests for that as an indication that the system is doing a better job? So those are places that we still need to work that out, but it seems like something in that zone is what we should be thinking about. And then 2B, the goal there, or sorry, the objective is improve data collection methods to better account for the scope and nature of homelessness experienced by, and that lists certain subpopulations that are disproportionately affected by homelessness. And then the evaluation metric that goes with that would be looking at how complete our data quality is in that area, the number of providers that are focusing, that focus their services on those disproportionately impacted populations, and also the trainings that are provided to make sure that, again, just like earlier, that those services are tailored to serving those specific populations. That's all of system goal number 2. So I'll go to number 3 in just a second if no one has questions.
Well, I would just pause just a moment to let people, folks catch up, and let's see if there are any responses to address system goal number 2.
And I'm also happy to restate or to expound on any of these. It is a lot to take in. As we already discussed, some of these they use a lot of like difficult to discern terminology. So certainly happy to dive in more and just provide further clarification. It doesn't have to be a question or a comment if that's not what you have. Okay, I'm going to move to number 3.
Okay.
System goal number 3 is consolidating the homelessness response and improve system accountability to people experiencing homelessness. And there's 5 objectives under that. First, consolidate and streamline funding for homeless services. And the way we'd measure the metric we would look at to measure that, increasing the number of, it says regional ILAs. Let me just put that in non-RHA speak, which is our agreements with really suburban communities. They're right now what is going on the north side, for example, is they are all pooling together all of their funds and entering into an agreement with RHA so that north suburban communities would have all of their homeless services flow through RHA as well. So the more of that we could accomplish, the more we would see that the system is becoming centralized. And then also like similar with like the number of severe weather contracts and that being centralized as well. A lot of the jurisdictions we learned over the summer are paying for these things to happen on their own and standing things up on their own and trying to get to a more coherent approach. We were asked for help in doing a lot of these, or kind of brainstorming on the better approaches, things like that. So that was objective A. Objective 3B, increase supportive transitions for individuals who exit King County jails and the Northwest Detention Center who are in need of homeless services. So this is really focused on individuals exiting some form of incarceration. The metric that we look at here is the percent of people that are exiting to homelessness out of that system. Percent that are exiting who had some kind of jail planning release or jail release planning. For example, the number of individuals that were assessed for court entry and housing needs, or had some other kind of the number of assessors that are actually engaging with our jails and other detention centers to assess like needs and eligibility for programs. Those are all the kinds of metrics that we could be looking at here. Again, this kind of really, I think, shows like how early in the development of these we are, but that's the general domain that we're leaning towards. And acknowledging that a lot of this is not something that's under RHA's control. Jail releases are not obviously something we'll have jurisdiction over. We can be good partners, and we can try to advance some of this happening, but this is a place where we are advocating for and trying to create system alignment, knowing that the other people that we're working with have control.
So we did get a comment in the chat.
Okay.
From Ben Schrader, who is supportive for increased supportive transitions for individuals who are exiting King County jails and Northwest Detention Center who are in need of homeless services. With their team, it's closer to 90% exiting jails and being homeless.
Yeah, and that's why we've identified this as a substantial area to explore, even though it's not under our control, that we have to address issues like that if we actually want to see homelessness end, that we can't just ignore the pathways that are exiting people into homelessness without the resources they need to get by. Marvin, was there anything else?
That's all I saw in the chat. Here, let's see. Yes, that's all that I saw in the chat.
Okay. Next, item 3C, develop, refine, and tailor processes for the Ombuds Office to further provide support to those seeking accountability. So this is really around, standing up and implementing the Ombuds Office to make sure that we are being responsive to the needs of people who are most impacted by these programs. The metrics to associate with that, there's a few different ones under consideration here. A survey or a focus group feedback, to assess the awareness that people know about the Ombuds Office and as an avenue for seeking support and especially when they've been harmfully treated by a system. Looking at the percentage of people that utilize the Ombuds Office, the rate that their experience results in some benefit for them, and the percentage of grievances that get investigated. So not getting, right now the number we're getting is not very high, but if we get to, but we're covering all of them that I think that have come to us. But if that changes, we would need to have that kind of understanding. So those are the types of metrics that we're considering at this point for this metric or for this objective, and ways of measuring, like, did we succeed in the Ombuds Office doing what it should do? 3D, increase supported transitions for individuals who are accessing or exiting emergency rooms and healthcare systems. So this is really similar to the jail release planning one. Only in this case, we're talking about emergency rooms and healthcare systems. Thinking about people are getting exited into homelessness with no other place to go and trying to address that. The metric we would look here, again, we're partners here. We don't have direct control over it. Some things we could look at, like the percent of hospital staff who know what response resources a person could be connected with. Percent of people who identify as homeless in emergency rooms and healthcare settings who are connected with a resource. So like increasing the rate that people are actually connected with some kind of housing or shelter as part of their exit, rather than just not discussing it at all, things like that. And then the last objective under this overall metric around consolidating the system, increasing accountability and transparency to community partners that representing disproportionately impacted and underserved communities. And the metric related with this one, the number of that we're looking at, number of convenings and communication pathways with community partners that represent those groups that are disproportionately impacted or underserved. I think this goes really hand in hand. A lot of these overlap or parallel with other ones, with other metrics or other goals. So if you think to the earlier system goal, when we're talking about agencies that are by, for, and equity focused, ones that provide culturally tailored services. In this case, we're looking at something similar here in terms of the number of communications, convenings, meetings, things like that, to make sure to get a sense that we are being responsive to the needs and have pathways that those needs are being expressed.
Jeff, can I just stop you for one moment?
For sure, yeah.
Could we back up to a clarifying question? Ben is asking about the Ombuds office. Can we just give a little bit more information so that he'll know, exactly what you're talking about?
Yeah, thank you for actually putting that out there. I'm sorry that I didn't think to explain it more. So the Ombuds office is a new thing with RHA, a need that is identified through a lot of the community conversations that led to the creation of RHA. It's an office that operates independently, looking into if there's a complaint about any a grievance with a provider around service delivery or how an individual was treated. You can elevate that complaint to the Ombuds office, and they will investigate that and determine if there was like what occurred, if there was something that was done incorrectly, and then seek to have it corrected. Initially, they just started coming fully onto line. They had to hire their staff initially to be able to do that. Because they operate independently, I have a little bit less visibility into their work right now. I know that they are doing investigations. There's a couple that I'm aware of, for example, that I've just heard there is an investigation going on, and like maybe mention like a provider or something and just say, you're not going to know anything else about that. It is separate from us. Also, to the degree that there was a complaint about RHA itself, needing to have that level of independence so it can look at if we've done anything wrong and make sure that the voices of people who experience homelessness or who have been impacted by the homelessness response system can express that. That's the goal of the Ombuds office. I'm sure Tamara, who's the actual Ombud, would say that more eloquently than me, but that's the high level. Sorry,
Did you say Tamara?
Yeah,
Katara Jordan.
Sorry, Katara. I used to work with a Tamara who did a similar job. Sorry.
Okay, yes, Katara Jordan is the Ombuds for RCHA.
Yes. I'll move on to system goal 4. There's 6 total, so we're more than halfway through, making some pretty good time here. This one is significantly reducing unsheltered homelessness. And again, this is starting to get into the space where RHA's 5-year plan is going to lean into more of its role as an advocate, but a recognition that we're not the agency that will, or the entity that'll have authority over some of these things. Most capital resources, for example, we don't handle capital resources. So you have like Seattle's Office of Housing, DCHS at the county, public housing authorities. They're the ones that actually would do a lot of this work. First is expanding housing to meet the need. And the metric we look at there is the number of housing units relative to what we've modeled as being necessary. We walked through that model during our last call to get a sense of the different types of housing models and how much we think we need of them. The next objective, scaling partnership for zero, so that we're achieving functional zero countywide. Just as for probably more for public consumption for those watching, Partnership for Zero is RHA's initiative that generally covers the downtown core, Pioneer Square, SoDo, and the CID, but not all of SoDo and the CID. That's the catchment area then, and it's seeking to achieve a functional zero of homelessness there. There's always going to be someone either that's experiencing homelessness that moves into that area, or someone that's newly experiencing homelessness that is going to first appear on the streets in that catchment area. But getting that number right now from where it's at down, which is in the close to 800 people, I think is who System Advocates have connected with so far, getting that number down to near zero so that the pathways out are parallel with the path, that inflow. And then that's what our overall initiative is. And then the goal here would be somehow scaling that up countywide. Now, obviously that depends on getting more resources. We can't do it with what we have currently. Christy.
Thank you, Jeff. Yeah, just a clarification on the catchment area. Do you include Belltown in that? And also, as far as downtown, how far east do you go? You go to the freeway?
It definitely covers
190?
the freeway, but I don't know the map well enough to answer your questions actually.
Should I take a crack for you, Jeff?
Yeah, Marvin
It
actually
does.
is the co-director of that center, so yeah.
Yeah, it does cover Belltown. It goes as east towards Denny.
East
Yeah.
towards Denny, and then
Yes.
how Denny, then rather than the freeway, you use that as your margin?
Right now, yes, because there is another part of the work of the KCRHA that addresses the right-of-way work that is
Oh,
done
okay,
in
okay,
conjunction with the state.
Okay, good. Yeah, that's what I was wondering, Marvin. Yeah, that Denny's kind of an odd street anyway, the way it winds and weaves its curve. Okay, thanks for the clarification on that, Marvin and Jeff.
I'll move to the next one. Let's see, improve longitudinal navigation and supportive veteran services for individuals who are experiencing homelessness. And this is basically a focus on veteran households and connecting them with long-term, ongoing support across stages. Some of the metrics that are being looked at would be the percentage of veterans who are housed out of the total number of veterans that experience homelessness. The percentage of veterans that are enrolled in services or are on our by name list, looking at connection to veteran specific services, looking at a reduction in the overall number of veterans who are experiencing in their households that are experiencing homelessness, or returns to homelessness for those households. Those are all the various metrics that are under consideration right now in this space to measure that focus on veteran resources. And then D, which is the last, I can't quite fit it on the same screen here. Improve housing and wraparound services for high acuity individuals. And so it'd be a lot of the similar types of approaches are what are under consideration. The ratio of people that experience homelessness and are identified as having highly acute needs compared to the number that are actually receiving services, and having that closer to everyone that would be identified as having highly acute needs, receiving the services that match that level of need. Separately, we could also look at reducing the number of individuals that are considered high acuity and continue to experience homelessness, whether that's at a moment or over time, something like that. Still in here, questions or comments, so I'll move to 5. This is ending unsheltered homelessness for families and children. 5A, fostering partnerships with healthcare and schools to improve wraparound supports for families with children that experience homelessness and to prevent them from becoming homeless. And, potential metrics here would be the number of active agreements that we have with those schools and other healthcare settings and partnerships to better connect data so we know and can serve those individuals in those households. 5B, expanding, the objective would be expand and pilot programmatic interventions rooted in evidence-based practices. This is really jargony, to address the needs of families at risk of homelessness. So basically doing more things that are focused specifically on families that might experience homelessness, that there's evidence behind. And then the metric here would be the number of those pilots or the amount of money we're investing in them, things like that, to demonstrate that we are utilizing those practices more. And then 5C, the last objective under this, increasing and expanding coordination between homeless service providers to ensure families that experience homelessness have a clear and quick pathway to housing. So making sure that we have everybody talking to get families that are experiencing homelessness into housing quickly and easily. Potential metric here, reductions in the return to homelessness for those families. Provider reports about increased coordination, shorter lengths of time experiencing homelessness or unsheltered homelessness, or increasing the number of families that are engaged by our outreach providers. Those are the different ones being examined at this point. And then the last one of these, and then we'll switch to a different kind of subject matter. System goal 6 is ending homelessness for unaccompanied youth and young adults. Again, there's 3 objectives. The first one, ensuring that all youth and young adults, particularly undocumented, disabled, Black, Indigenous, trans, and gender nonconforming youth, have geographic access to homeless services. So we have services, geographically speaking, where youth and young adults, especially in any of those subpopulations, can connect with them. And then the proposed metrics around that would be documenting changes in the landscape. So we have done a landscape analysis and know who is serving what where, and see big gaps where there's just nothing in the county. So addressing that and closing that gap. Doing an analysis of, might entail looking at where we know populations of youth and young adults that are experiencing homelessness are at relative to where those providers are, or even getting community feedback about the accessibility of services. Those are all different ways we could approach or begin to look at that kind of metric or that kind of objective being accomplished. 6B is developing a coordinating body to coordinate cross-system alignment and strategy. This would be focused on youth and young adults. Specific youth and young adult body, a metric looking at the stand-up of that. Has it happened? Does it include cross-system partners? There are a couple different ways we could look at that. Or looking at measuring functional zero towards ending youth and young adult homelessness. Like, are we making progress in actually eliminating homelessness among that population? That would be a component that likely would rely on some of the increased resources that are part of the other modeling that we talked about separately. And also there's a lot of partners we have to really engage with, child welfare being one that comes to mind immediately for me. And the last one, in case I've lulled everybody to sleep, make sure that you can nudge yourself awake a little bit. 6C, expand and support an array of housing and programmatic interventions that are attuned to the developmental needs of youth and young adults. Based on evidence-based and best practices, I won't keep reading. Basically, it's having youth-focused services that we think that things that we know work for youth. And in this case, like one way to measure that or evaluate ourselves on that would be looking at the implementation of those new strategies. And it might be like how many providers have implemented it or what level of training has occurred to make sure the providers are implementing it, something along those lines, to measure, like, are we doing the thing? Have we put dollars, like look at the number of dollars we put into those new intervention strategies, things like that. That is all of the system goals and objectives and metrics. Christy, thanks for raising your hand. I see you again.
Hey, thank you, Jeff. There seems to be quite a bit about youth and homeless, unsheltered youth. I would like to know what you're doing now to partner and communicate with the Youth Action Board and how you're building relationship with them. There's been some differences of opinion with the current iteration of Youth Action Board. And so I'm wondering what you're doing to repair that, or how you're working to strengthen that, or what are your ideas going forward from here to work with the Youth Action Board, specifically the people that we are familiar with as a continuum of care.
Yeah,
Yeah,
not the new hire who was not advised by us or the LEC to be hired. We're not talking about Sean specifically. We're talking
Correct.
about the partnership and the collaboration that was left out and kind
Correct.
of ignored and
Correct.
blackballed, not only for this board
Correct.
members, but the YAB themselves, as well as the LEC, because all three of those entities influence that. And yet it seems that the KCRHA has made their own decisions and done what they wanted to without the advisement or collaboration amongst those other people and entities that we all represent.
Correct. Thank you, Shawnee, for elaborating on that for Jeff. And I don't know how much Jeff knows about that, but pretty much the YAB was blacklisted and flushed. So we'd like to know where are you in the process of communicating, reestablishing, or have you cut ties? Have you started a new YAB board? What's the haps, Jeff? We'd like to know here on the COC.
Yeah, thank you for flagging some of the history there. That was before I joined RHA and I wasn't aware of that history actually.
Right,
So
I didn't think you knew that. So thanks, Shawnee, for pointing that out too.
Yeah,
Appreciate
that's
it.
typical of KCRHA right now. Not being fully
It really
transparent.
is.
And
It really is.
and so that's why I said at the beginning of this, I was interested in how you were going to present, because it seems that they have been what I would perceive as setting people up for unsuccessful adventures in these conversations without you having the context or background in regards to those relationships that have now dissolved in some ways and at times seem unrepairable due to the lack of engagement and, again, transparency and collaboration.
The prior YAB was quite an entity that did quite a bit of good. They did a lot of work within the community, within the county, within the city, and within the state. So we were all a little bit shocked and surprised to hear that they were no longer welcome at the round table here.
So I don't know the answer to your questions. I'm not going to pretend that or give you something that's not true there.
Well, it's out in the open now. It's on
Sure.
record and it's out in the open.
Exactly. And so
It's-
it's something that we can absolutely document as we've been asked about this and consider how we're going to pursue that. And there might
Correct.
need to be some changes made to reflect that based on that input. And I will say that I'm doing a lot of these kind of walkthrough presentations and hearing feedback from groups. And this came up one other time as well, without giving me the context and the history that went behind it. It was just hey, how are you collaborating with other entities that have existed around the youth space? So I definitely have noted that. As I'm taking quite little notes here as well as I present. So thank you for highlighting that.
You're welcome, Jeff. I'm glad we could bring you up to speed and you can hear a differing point of view. So let's all work together on this to end the homelessness. That's what we're all here for, if I'm not correct.
Yeah.
I'm not mistaken, I should say. Thank you. And thanks, Shawnee, for bringing up what you said, what she said.
Absolutely.
Are there any other comments or questions? Any other places that might be useful to have just more discussion?
I'm sorry, is there a place on here in regards to the point in time count? Is that a thing in this 5-year plan?
None of the goals that I goals or objectives that I walk through specifically talked about the 5-year plan. Can you say more about what you're thinking?
Well, just the point in time count, right? And if that's going to be included or a tool that we're still looking to use to get and gain data in regards to the people that we're serving and the needs and resources that need to be provided to our community members who are unhoused.
My understanding is that
keep
it's still
doing
a
it.
HUD requirement. So regardless of whether it's most strategic, or I guess regardless of whether we find it most strategic, it will still be required by HUD.
Exactly.
Correct, but that's what I'm saying. I don't see anything here to address it. And the only thing that I do know that addresses it is in question right now in regards to the last point in time count and its validity. And again, the resources that were put behind it are just not advisable or recognized by other entities, including ourselves, again, the LEC and other members and entities that play a role in this.
So is it
So what
Leah?
I'm asking is that's got to be brought up, Jeff, because if it's not there, it needs to be, right? As she said, it's required and we don't have it in here.
I think
I
that
am Liz, yes.
so as Lee's noted, we're not going to have a choice but to do it. And Shanae, I think that you're highlighting the same thing, that we need to be more explicit, like to what degree does our plan encompass either some new thought or new direction around the PIC count? Is that the right feedback I should take? That's all I'll capture it, at least. Because I think you're right. We're not touching on that at this point, which is an oversight.
And historically, our 5-year plan has been given to us on a monthly basis with Owen Kafzik. I'm screwing his name up, but the data maven, who was instrumental in creating a new type of metric-driven 5-year plan. A new metric-driven point in time count that he's just in the process of getting around to. It's more quantitative based rather than qualitative based. I know that we're looking at that as a new paradigm for data gathering as a KCRHA, but I don't know where we're going, if we're going to keep doing that or if they're still going back to the static model of, January freezing cold night, everybody points. So, but Shanae has a point that's part of our job, is to recognize that that's not there and we need to have that there. However, whatever iteration it's going to be.
Mm-hmm. Yeah, absolutely. I don't know the answer to that. I would be surprised if we return to the model that did even more undercounting than what we did most recently. There's a desire to make that as effective as it can be. And we, as we talked about last time, getting the 500 or 600 interviews was incredibly helpful because it helped inform, it gave us real data to inform the housing models, for example. There was value in doing that. And I know that having just a number where we just count people without any engagement on a single night and miss huge proportions of them, there's less utility in that.
So it's odd that one of our primary purposes as a COC board is to ensure the oversight of that one night count, that it's not listed in a 5-year plan. So I'm glad that that's been brought up, and it's been brought up again. And I want to make sure you underline that, highlight it, and in pink, please.
Yeah, I'll make sure that happens.
Thank you.
Gracias.
So I'll move on to, we saw this last time in a slightly different form, just talking about the percentage or the types of housing models that we're looking at. All the ones in gray, which don't really fall for the most part under RHA's authority, jurisdiction, purview. Some of them, to some degree, we have a role. Obviously, permanent supportive housing, we have a role on placements. But again, we're not an agency that has capital funds to build these kinds of units. And so we put those in gray. Whereas what you see in either a green or a yellow tone is all the things that do clearly fall under the role of RHA. And we talked about all these models last time, what they were, where they came from, that type of a thing. But the new information that I wanted to highlight this time around is focused on the cost that we're going to assume one unit for each of these requires. You can look at, on one hand, there would be one-time costs, assuming new construction or assuming that we'd acquire a unit by buying it. And then separately, there would be the cost to operate it going forward, which would, so like master leasing would have a little bit more cost because it would actually entail renting a unit on top of just paying for the services. The first one on this list, permanent supportive housing, is the one that I think causes the most reaction, because we currently pay something like $30,000 for a PSH unit. There's a couple of factors that go into this different number. One is that with all of these models, recognizing that individuals working at our providers are tremendously underpaid and often qualify for the programs that they are running. We wanted to have some kind of a metric that would increase wages, but we also wanted to pick something that was, knowing that would be a debate, and of course the policymakers and politicians are going to have control over. We wanted to pick something that was just felt pretty neutral and objective. We ended up choosing 80% of the area median income, which in King County is about $80,000 per year, because for two reasons. One, that is, if you earn $80,000 a year, you would not be eligible for most HUD funded programs. And two, that's been estimated as the salary you have to earn as a single individual to be able to afford a one-bedroom apartment. And they happen to be the same amount of money. So that was what we used. Anytime we took staffing models that our current operators use and raised any wage that was below $80,000 up to $80,000 and came out with some of these numbers. That's one big reason for the higher increase, or the increase in cost per unit. And the other one, especially with PSH, whereas we have with shelter models, we have numerous contracts we could look at and kind of get a sense of like what the staffing structure, how many of this person, how many people on duty at this time, so on and so forth. We have fewer of those for PSH contracts because many of those haven't been given to us yet. And so we didn't have the best way to make sure we had the right models there. And I think that that's actually an error that we don't, and we need to fix some of those. And I hope that's why I wanted to make sure that these two slides, that this one and the next one, are put on screen for you. And to the degree that you work in an entity that can provide insight on that, we're welcoming that feedback. With that, Christy, I see you have your hand up. You're muted though.
Thank you, Jeff. Yeah, I just unmuted myself. One of the things that when this board started, I was looking at different models of homing, and I differentiate that word rather than housing, because we're looking at current housing models that are based on single occupancy dwelling. We're looking at 1 bedroom, 1 bath per person. And one of the ideas that I'd come up with, and I don't think it's really been explored, but we could get a lot more bang for our buck if we looked into cohort housing or familial housing or shared housing, because we have a lot of people that fall into those categories. There are a lot of nationalities and ethnicities that do well in communal groups. Military veterans do well in communal groups. Native Americans, my own family, do well in communal groups. Young people do well in communal groups. Why are we not utilizing this / exploiting this to get a lot better bang for our buck because of the scarcity of single family units on the market, especially in such a tight market? Now, have you been exploring that? Have we looked at that? Have we looked at changing the definition of housing unit or / homing unit? I'm not sure what you'd like to call that, but I think we really need to explore that. And I think that we could get a lot more bang for our buck if we were to look at that. And I know that Seattle Housing Authority's got their definitions, and we need to go in and look at the paradigm for changing that, but that's who we are. That's what we do. That's what we want to do. We need to do something about that. So I want to bring that up as a discussion for the bigs over there. So thanks for letting me share that.
Absolutely, and I really am appreciating that feedback. That is actually, it's on the next slide, so you couldn't see it yet, but that actually, our modeling does incorporate that as a portion of what, and if you wanted me to scroll back up, so it's not, where is it at? Shallow subsidy. So shared housing wasn't a huge number. It was only about 1% of the total housing that we were looking at. But the basis we can use to come up with that percentage, and these could be wrong, right? This is modeling based off of data we have now. If we see more people start to express a willingness to do it, we would obviously change course because it's more cost effective. But we looked at in all of those 600 interviews, then one of the questions or some of the information from it was a willingness to be part of a shared housing situation or having roommates. And that was what informed that group there. Some of them might also, you might see individuals, like when you look at shallow subsidy, there might be some parallel there, but those are the different models that we're talking about. And you're exactly right, like trying to utilize more efficient in terms of a cost perspective, more denser kind of housing arrangements when people are open to that and actually would be happier in that.
Exactly. You see that on the street, and a lot of our encampments and a lot of our people are hesitant to utilize shelter or go to Mary's Place or something because they don't want to leave their peeps. They don't want to leave their community, which is what they've built up there. So, and if you're getting 2 hens go farther than 1 hen. You know, you can make a bigger omelet with 2 hens. So yeah, it's a great idea. So thanks for incorporating that, and let's continue the discussion on that. Keep bringing that up.
Yeah, since we are on that one, let me jump down. I started to look at PSH as an example, but let me jump to that second slide and look at shared or communal housing. It's a good example where we looked up what the fair market rent for a 3-bedroom apartment would be right now. divided it by 3 people, because you'd have 3 people, 1 in each bedroom, and then made some assumptions about like what kind of services you'd have to provide with it, and look at what that comes out to be cost-wise, like $64,000 a year. Whereas some of these others, like where's affordable housing? Affordable housing, you would have to build something at the cost of $400,000 per unit. So there's a big difference in cost there, and that's why we want to make sure something like that is reflected in our like cost modeling here. I don't plan to go through each of these in detail on this call. I think that wouldn't be respectful of your time, but that is like all of these are laid out here to the point that we have modeled out so far. And if you see places where you have questions or comments, we would welcome that kind of input as well. And Marvin, that actually is, and Shanae, that's the completion of what I have. I'm happy to answer any other questions or return anything that you'd like.
You have a question from Ben.
Hi. I posted in the chat, like there's these European housing styles that I think, you know, like it kind of respects community. It's about community, and it's cost effective. It's almost like I think someone said familial house. I don't know if that's the right definition, but where housing is built based on a family living environment, and I'm not sure exactly who all is taking all this money and building housing, but it sure would be nice if Seattle could be a leader in addressing homelessness by using housing styles that have been very proven effective in Europe, and start doing that here. Anyway, I posted a couple of articles. The other thing we were talking about, like why people won't accept shelter housing, and besides the thing that shelter isn't housing, it's shelter. As someone who's spent time doing outreach into camps, there's just too many barriers for people in a shelter environment. If they have a dog or a cat, well, then a shelter is out. If they have a partner, that shelter is out. And I know that we're building a lot of tiny village housing. I looked on that pie chart that you provided, and their tiny village housing is what, less than 1%. And I know that we're building a lot more, and I know that there's been a lot of partnerships with community organizations and so forth. But I certainly think that this is something that is a good thing. It's something that people that are unsheltered currently are more amiable to than a traditional shelter. And it's a good transition, because when you have the availability of, well, besides the fact you have the availability of showers and hot water and so forth, but also supportive assistants, case managers, and people that can help direct them towards services, it's a great starting point to the next step of placement into permanent housing. And I mean, it's all a big equation, but I just see that this is these are things we need to look at seriously. Thank you for letting me share.
Yeah, thank you, Ben. Actually, that's very helpful and affirms a lot of things that we actually talked about during our last meeting together around the largest component. I can put it back up on screen, but on the pieces that did fall under RHA's purview and control, emergency housing is definitely the biggest. It's at least half, if not more than half. And the understanding there, the reason tiny home villages was so small is emergency housing was being seen as non-congregate shelter units that are not, 5,000 of them in one spot, but you have to have them located out. But think about what has been going on with the usage of hotels, for example, as emergency housing, and the tremendous receptivity to accessing those kind of units. And that's why we're RHA's plan is only proposing supporting that non-congregate approach, and especially with the something like a hotel room or those non-congregate emergency housing, something that, as you said, shelter doesn't end homelessness, housing ends homelessness. So something that can be transitioned into being housing at some point along the line too, that is already set up in such a degree that that can happen. Whereas if you have 500 people in a room, that's not going to transition to housing at some point. So that's going to always have to be a shelter. So that's why the plan includes those kind of models, but excludes something like your congregate shelters that are big and large.
Thank you, Jeff. Are there any other questions for Jeff?
I
All
don't see
righty.
any hands raised.
Okay. Well, thank you again. I think we're ready to move on to the next portion of our agenda. I am looking for, so I believe, if anyone wants to correct me, the next part of our agenda is looking at the System Performance Committee and COC Board / CEA applications.
Correct.
You want to lead us through that, Shanae?
Yeah, let me pull it up. Well, Christy and and Tamara have issued out the System Performance Committee, something that they have spent hours on perfecting and getting together with proper language and capturing the look that we want to provide in that, in the space that the population that we want to bring to the table. And so it was in your guys's emails. I hope that you guys have had a chance to review that, look at it. And if there's any feedback, comments, questions, concerns, or solutions, they are prepared to answer those. So we'll start with that application first, the SPC.
Thank you, Shanae, for acknowledging the hard work that we did on that. It was a grinder. But I appreciate the application that y'all put together for more members of our COC board too. I like the simplicity, the straightforwardness and the wording of it. So if there's a way for us to bring the general meaning of the applications together and then split off where we need to split off for particulars, then I'm all for that. Tamara?
Yeah, the only really thing I have to say about it is that it was designed to entice more folks that don't necessarily operate within housing to join the team, so that we can really have a robust cross-sector approach to like measuring our performance as a homeless response system, because as we know, housing touches all parts of our lives. And if we don't have a home, then we're extremely vulnerable to like all the social ills that you can think of. So that's my take on it. And I think Janelle had mentioned some things about it being a requirement for the System Performance Committee to have like an independent body of work that that really now we're trying to shift towards being more community driven. So that's my two cents. And I put the current version in the chat.
I do have a question. Are we sure about the commitment of the hours, 4 hours The reason why I asked that is because even us here as board members, we know that when we signed up, it said something similar and we have exceeded that 3-4 times the amount. And so just being really transparent, do we think that the 4 hours is enough? Should we put like 4 to 6 or something, just to cover our bases? Because we do have special meetings, things like that, that do pop up that require more than just, you know, the natural 4 hours. So just, that would be one of my questions.
I think
That's
that's
a good point,
totally a
Shanae.
good idea.
That's a good point. We don't want to scare people away saying the rest of your life's going to be dedicated to this, but it's fair enough. I mean, we could easily put in 6 hours instead of 4, because as we do have a standing meeting on the first Wednesday of the month prior to our COC meeting, which is just our staff meeting, and then we have our public meeting 2 weeks after that. So we meet already twice a month as a board, and it works out pretty good. We get everything we need done in 4 hours. But if there's documentation, or we need to go over other information, or we have questions, or we need to get together with one another, then there is extra hours. So I'm not averse to saying 6 hours. What do you think, Tamara? It's a good question, Janine.
Yeah, no, I think that's a good idea to just have a range so people know that things aren't necessarily fixed, but it could be a varied, you know, pace for getting
So
the
4
work
to
done.
6, 4 to 6 hours,
Yeah,
minimum
and a
4 to
lot of
6
this
hours.
work is going to be informed by our partnership with Full Frame Initiative, and that, because it's a new initiative, it's a new, well, they're not new, it's our new initiative to bring them into COC work. That's going to take some time. So
And
that
that-
it's a
yeah.
great suggestion to expand and not just limit it to 4 hours, but have a range. So thank you for that.
That's a great, yeah, that's a great idea too, because now that Natalie's gone elsewhere, bless her heart, she's so talented, and whoever gets her is a gift. But we're gonna have Tanya as our liaison with FFI. There's a lot to unpack with them as well. There's a lot to learn, which has just been so helpful with my work here and with the board and just within life in general. So yeah, 4 to 6 hours, you think? Tamara?
Yeah.
Shanae?
And I think just to reiterate that the Full Frame Initiative is like the perfect vehicle for systems change when we're
Yes.
talking about like any social justice issue, but they are a
Yes.
perfect vehicle for that. And so
And
I
they
hope
are
that you'll
issue-
see that with time.
Issue agnostic.
Issue
I really
agnostic.
like that. Issue agnostic. Yeah, and you called that, Cameron. You called SPC as being a good vehicle for FFI. So you go, girl.
My other thing, I mean, I'm just going down the list, y'all, okay? Just going over the
Okay. That's great,
next
Shanae. Thank
we
you.
have, how can this make a meeting accessible for you to participate in a meaningful way? Is that asking for like what their ableisms are and any accommodations they may need?
Correct.
Okay. And then full name, we asked about race and stuff, but we're not asking about pronouns. Is there a reason why we're not being inclusive of that?
No, we
That
probably
is
just forgot.
You're full of great ideas, but yes, you're right. We should have that on there.
We just
I'm not trying to
forgot.
put y'all on blast. These are just things that I'm reviewing.
No, that's
I
great.
really appreciate you
Shanae,
guys'
you
work.
want to be on our committee? Man, we're gonna hire you.
Just things to be thinking, right?
Yeah.
That's good. That's why we're paying you the big bucks, right?
Man, let me see. Race, phone number, email, preference of contact. So when we're asking people, what is your current professional role? Oh, I see, if applicable. So they don't necessarily have to be in a position of professionalism within our
Right.
system, correct?
Yeah, and that goes into what Tamara was saying about trying to get a well-rounded, varied group. We've decided when we formed this group, or when we started this committee, that you needed brains and heart. You needed data drivers like Owen and Janelle, and then you needed the heart, like Tamara and I are pretty much touchy-feely guys. So if somebody's already works in data, then they're going to maybe be a good fit. If maybe they're a nurse or a bus driver or something, maybe they've got a touch with people. So if they've already got a profession, that tells us a lot about them already. Whoops, somebody's ringing.
No, that's good. Thank you for that. So then we asked about their experience in regards to homelessness, being unhoused. And then we get into a little bit more deeper dive. Please describe how racial discrimination in housing has affected you in your work or in your life. Please describe what housing justice in our region would like, feel, or sound like to you. When you guys are asking that second question about housing justice, what are we trying to capture as an answer?
I think for me personally, I was like trying to build on this momentum that I had started with a Full Frame Initiative and designing a mini series about housing justice. And so I'm trying to see about like steering our community towards an approach that that amplifies housing as a human right, as a justice, economic justice issue as well. And so trying to get at narrative and culture change and thinking more about housing as a right, not just a basic need that everybody needs, but it is your right. You are entitled to have a roof over your head, a place to sleep at night, and food to eat, and your good health. And so I'm trying to, that was my intention with that question. I don't know if I got it right, but that was the intention.
No, thank you for that. Let me just, I'm sorry, I'm just going through the motions.
No, I appreciate it.
So when we're asking, I guess kind of going into what you just said, right? Housing first approach. In those questions, trauma-informed care, harm reduction strategies, racial inequity, these are questions in the last coming days of my new position that I've actually had to ask my new hires myself in the screening process. And I'm wondering in regards to that, what are we using as, I guess, the definitions for those to, I don't want to say judge, but to like, okay, somebody says, oh, housing first, that means you know, everybody gets housing. But like you said, is that really everybody? Or, you know, are people cringing when they see sex offender flash across their page? Are they cringing when it's a domestic violence perpetrator versus the victim, right? And being able to check their own biases, and then just a general definition of what those are to us versus what it may mean to the general population, or like standard dictionary definitions. And so just wondering what we're using to as like a baseline for those definitions, and what that means that we'll be expecting in an answer. If that makes sense.
Good question. Yeah, absolutely. And I think from my perspective, it's we could potentially just start the conversation with like a definition of implicit bias, so that people know what we're trying to avoid in hearing from their responses. And I think I think it also, like, can we draw a connection between what their response is to the values and priorities of the COC that has been established? Yeah.
Okay, that makes sense. So it's with our COC values and our standards, and you know what the theory of change, all that, how those answers going to relate back to that.
Yep.
Okay.
Transparency, yeah. Sorry that I logged myself off there, Tamara. I'm sure you did a good job answering.
No worries.
In regards to like harm reduction strategies, that's one for me that I think most people just revert back to SUD services, substance use challenges, and really just highlighting that harm reduction is also how we're showing up, how we're talking to people, being attentive listeners when we're servicing the people, and in the language and words that we use, they have power. And so really kind of, I think that's kind of a two-part thing. Most people just kind of go to that harm reduction of SUD,
Right.
but really you know, it's deeper than that, right? It's you showing up and not worrying about your grocery store list or picking up your partner tonight after work. It's really how you're adjusting the power dynamics, coming out from behind your desk, offering, you know, water, right? All those different types of things, the environment, as well as your internal checks. And so just make sure, like, when we're asking these questions, you know, furthermore in person, that we're also looking at harm reduction on the bigger scale and not just the SUD lens.
Yes, I totally could not agree more. And when I kind of thought about this question, I thought about like the do no harm, like what doctors have to swear an oath to when they're treating their patients. Like you're supposed to
Hippocratic
do
oath.
no harm. So
Hippocratic
I
oath,
guess
right.
as one of the question askers, that's what I would kind of be listening for.
Okay.
Going beyond just like substance abuse or substance use to all areas of a person's lived experience. Oh,
Absolutely.
Right. Hey, I wanted to let you guys know just on that harm reduction, in case you didn't know, I think it was last Thursday, 988, our new emergency services number, 988, rolled out an option 4, and it's for Indigenous people. And it started here in the state of Washington only. There are 16 trained counselors who respond. So if you are a Native American in the state of Washington and you're facing crisis, you're suicidal, you're homicidal, you're thinking of self-harm or using, or you just need to talk to somebody, you can call that 988 line, hit option 4, and you will be connected with somebody that will speak your lingo. Maybe not your specific language, but your lingo that can talk about the res talk or talk the street talk of your language, because not everybody has the same language for hurting. So I just wanted to roll that out for you guys. Thank you. And thanks for bringing that up to me.
The other thing that I was thinking is that we just have listed barriers. And again, this is just really powers of words, right? But maybe if we wanted to like put a / challenges, because not everything is necessarily a barrier, but it can be challenging to overcome some of that. You know, just to be clear of what we're asking, right? We say it a couple of times, like barriers, but it can also just be a challenge that you may see in the homeless response system, or, you know, better understand the challenges that people are facing and how to improve those.
yeah.
Reframe how we talk about homelessness in our region by using stories of those living experiencing homelessness. And why do you want to serve on this committee with skills experiences? Yeah, that's a big one, and I'm glad that we're asking, like, why are you here, right? Why? What are the real intentions of being here and wanting to do this work, right? How are you going to show up to serve the committee and the community? And so I really love that question. And again, I think you guys cover that well in regards to, like, it could be lived experience or professional experience. But why are you committed to this work?
Right.
And then
what do you bring to the table?
Yeah. And then, yeah, what is the impact, right? Are they aware that they have power, right, in this position, and recognizing that positional power as well as relationship power that these seats hold?
Yes. That was perfectly stated.
Well done, Shanae. You're hired.
I'm telling you, I've learned a lot in the last couple of weeks. I'm really putting on my boots and diving deep into this stuff and hoping to bring that all back to you guys.
Changing your tank out. You're out of oxygen now. You need some more.
Well, that's all from, you know, this peanut gallery over here. I'd love to hear from other members on what you guys are thinking in regards to what I've said and what you've been able to review today.
Well, I like the way you sussed us out by clarification. That was one of the biggies when we were putting this together, is let's keep it in language that's easily readable, easily understandable. But I do also really like the work that you did on the COC application. I like it. It's a tight little document and it looks well, it's easy to look at, easy to read. So
Yeah, your additions have been spot on.
we're gonna vote on one or the other, or are we still gonna go over the CEA application? Is
So,
that
well, I just want to address in the chat. So Benjamin, you're asking, today, that's what you're hearing is us voting on the approval of this application process. Once we have voted for this, it'll be given to our tech team. It'll be uploaded to the KCRH website with job descriptions, outlines, and you'll be able to either submit a electronic application and or a PDF if that's what's needed. And then after the first of the year, we'll be scheduling interviews and reviewing those applications, things like that, to get people in the positions that we feel best meet the needs of what are asked.
Okie dokie. You don't need a temp person, do you? It's kind of like a tryout, right? Because I don't know, I just saw a couple of people quit at the start of the meeting. So, just saying, I mean, I am here. So if you need an interim person,
it's nice. That's not how we do it.
yeah, I know. But my mom said if you don't ask, you're never gonna get it. So
Encourage you to apply when the applications come out.
I will. I fully intend to. Thank you for allowing me to speak up when I otherwise probably shouldn't have been. So thank you.
No, you're good. Thank you for asking, right? Closed mouth don't get fed. And now you and others know like what the process
I wouldn't
is.
know.
Just have it that way for equitability, right? There's tons of people that would just love to like volunteer and hop in, right? But we're very intentional with the space. And again, as you heard, it's a power dynamic. And so really placing the best possible candidates in those positions that are going to be able to represent our community members that are not heard and seen in ways that they need to be. So thank you for that. Anybody else? Board members, anybody want to comment on the application? Or are we ready to vote on this?
Before we vote, can I please get clarification? With 2 members, 1 member resigning and 1 member quitting. At 7 members, I do believe we are at quorum, and I just want to get an acknowledgement from the committee.
That was my counting. That
is definitely Marvin's position. He keeps me in check and helps me with that. So if you are in agreement,
I second. We're always at this meeting, you guys.
Yeah.
Yeah.
So I think we're good with that, Catherine.
Okay, I will go ahead and acknowledge in the notes that with the resigning and the quitting of a member, the advisory committee sits at 7 members present, which meets quorum.
Thank you.
Hey, thanks everybody who shows up every month. I want to thank you guys for showing up every month, no matter what.
I would like to make a motion to approve the System Performance Committee application with Tamara and Christy updating the hours and adding the word challenges along with the barriers in those few sentences that I mentioned, and then adding in regards to the pronouns. Those were the 3 changes.
Perfect.
And so just want to make sure we add those 3 in there, and then I'd like to move forward on vote a yes motion.
Can I second that? Can I second my own application?
You may.
Oh, good.
Catherine,
Thank
will
you.
you
Then I
do a
do.
roll call?
Correct. Can I just clarify? The motion is moved by Shanae and second by Christy.
Correct.
Correct.
Thank you,
Yes.
Catherine.
I will take a roll call. Tamara Bowman,
Yes.
Reverend Dr. Kelly Brown,
Yes.
thank you. Lise Castro,
Yes.
Shanae Colston,
Yes.
Marvin Futrell,
Yes.
Christy Hamilton,
Oh, yes.
I am Sherry Tillman,
Yes.
for the sake of staying accurate, I will call off the rest of the members. Brianna Franco, Marisol Tapia Hopper, Benjamin Misk, Noreen Hill Oneida, Linda Peoples, Christina Sawicki, Robin Tasuda. These members are absent and unable to vote. As we stand, the motion carries to approve the applications for the COC and the SPC.
No, this is just for the SPC.
Oh, this is just for the SPC?
Correct.
Okay, let me correct myself. The motion carries for approving the SPC application to be uploaded and moving forward with. Passes with 7 yeas, 0 nays, 0 abstentions. Thank you.
Awesome. Thank you all for that. So the next one we want to review is the application for now. What I have been informed today is now 5 seats here on the COC that is open. And then revisement of the CEA. Thank you, Ben. We appreciate you being here and we hope to have you at future meetings. Be on the lookout for those applications too. Moving forward, this next application is for being held for both of those, the seats that we're looking for here on our advisory board, as well as the CEA PAC committee that is in an under construction revisement. And so that was our intentions in regards to this application. And so at the top, it just right now says continuum of care. That can be adjusted for CEA as well. Similar information, contact, address, phone number, how to communicate with people. And we just asked them right off the gate, like, again, why do you want to be here? What is your goal? What is your intentions for wanting to be on the COC? Our second question is what skills and experiences will you bring or draw upon as a member of this advisory committee? We're asking people to please list any experiences or familiarity they have with, so I want to change that, right? It does say with like homeless housing services. So I don't know if somebody has like a better suggestion, more maybe not so abrupt, I guess. Words have power. Program delivery, funding, continuum of care, and other relevant skills. I think that's a similar question that you guys were asking as well. And then we want to know about, as Chrissy said, right, the visionary of it, right? Where is that going? Like, what is the dream and the ultimate goal of a successful continuum of care advisory board? And then how does systematic racism impact housing and the root causes of homelessness? Another similar question, right? We're just trying to capture again how that's playing out in one's life, whether that's personal, professional, or other. Question 5, what does the theory of change mean to you? And how will the theory of change impact your leadership on the advisory committee? Getting that buy-in, right, of what our values are. Tara spoke about that, like, oh, this is our values, this is our, our policies, our guidelines, and how is that affecting one when they're showing up in these spaces? And then if there's anything that they would like us to know about them or details that they would also like to just volunteer. Then we go into affiliation. We're asking just yes or no if they have lived experience with homelessness. Again, that could be anything, right? It doesn't have to be like you yourself. It could be like, oh, your youth or your partner or an extended family, right? It's the experience that you have with that. It could be in a professional capacity, or it could be, in your own life capacity as well. Public or private funder. We ask this question because, as it's known to us that on the CEA end here, that those positions are very, need to be filled by certain members, right? They have to have that. Specifically asking, in regards to our COC board, the three that were identified before was we're looking for someone with incarceration, criminal justice background. What were the other two, Marvin? I'm sorry. Do you have those offhand?
Yeah, we had a youth seat. We have our youth seat. We've covered criminal incarceration, but we also wanted to make sure our disability focus had a seat. We have a funder seat open, and I can't remember the last one, but we did identify making sure we had representation of all of the continuum of care that we named in our charter.
Thank you. And that information I know came from, again, the feedback from our board members, and then what is required from our charter on what we wanted to, again, have in these positional seats. And then going down, intersecting systems, whether it's behavioral health, child welfare, criminal justice examples, those are some of those that just have to be fulfilled in order for us to be more inclusive, and really representing the populations that are most vulnerable in our community. Faith-based organization and partnership. That's, again, just making sure that we're being inclusive of all. It's not to call out anyone's religious and or lack of faith-based things. We just want to get a good pool and mix of people. And then in regards to homeless housing and or service providers, are they already working in the field? I think Tamara and Christy said that earlier, that it could be like a data-driven, but they're looking for someone who might not normally be in that pool. And for us, it could be either. And then any other affiliations that they'd like to know. I and many of us here wear many hats, different committees, boards, and representations of, and so just letting them be able to include that. Again, hoping to include those who may not have been included in previous times, and looking to expand that to others. We also have our subpopulation representation. We encourage to check as many boxes as you can, or as that you feel a need or identify or apply to you. And that is, again, listing some of our most vulnerable populations, such as youth and young adults, families, chronicness of people experiencing homelessness, single adults that aren't experiencing homelessness and are non-veterans, domestic violence, veterans, immigrants, and refugees, American, Indian, Alaska, and Indigenous communities, and Black African American communities. Then below that is our region. Again, just checking on what specific experience or expertise people have within King County, whether that be north, south, east, or west, downtown, whatever. The areas in which they are known to either live or be productive members of, the community engagements, things like that. And then we did ask them to optionally identify their race, gender, sexual orientation, age, and disability status. I will tell you that that being optional, that is something that I full-heartedly intend to ask in the interview process. I think that is something that needs to be done. I mean, we can get someone who race and ethnicity who may be misidentified as white passing, right? And they have that. So I just want to know and make sure that the representation's there. Again, gender, pronouns, sexual orientation. We want to be inclusive of all genders and sexual preferences. And then age and disability, that we know that the younger you are and the older you are, there's just natural stigmas and biases that happen with that. And then people's ableisms, making sure Similar to y'all's question, like, are we going to be able to provide the services needed, accommodations, things like that, that a person will need to be identified as and included in, as Marvin said, we have specific seats for that. And then we
Sorry, I
get-
don't have this right in front of me, but would you be willing to read the gender question to me?
Yeah. It literally just says identify optional, and then we list race and ethnicity, and then it's blank, gender blank, sexual orientation blank, age blank, and disability status. So it's kind of fill in the blank. And just listed as how they're identifying as an optional fill in.
Gotcha. I think that like if we, I don't know, it's kind of iffy. Because if we're looking for like queer folks to be on board so that we could have like more diverse experiences, then asking gender doesn't quite get to like whether they're like trans or not, which is like one of the populations that we would want representation from. So I think maybe like, I don't know, maybe like a question. I don't know. I feel like if we are asking like if folks are a member of the LGBTQ plus community or not, then asking their gender and sexual orientation doesn't like explicitly get at that, because like for example, it could be like a transgender woman, and if they just put like I am a woman, like that is completely true, but like doesn't tell us whether they represent that community. So maybe like a question first that's like, are you a member of the LGBTQ plus community? Explain if you would like.
Okay. No, that's great. Thank you for that.
For sure.
Christy has her hand up.
Yeah, go ahead.
Oh, thanks. Hey. Sorry about that. It was quite a while back, and I think I've asked this question before. It was about the funders. Are they from private sector, public sector? Does our charter mention that? Do we have a mandate on that, or what? We need 2 on the board, or we're thinking 3?
We need 2.
And does private or public sectors?
It says public sectors on the chart. We didn't
Is
have
that
a,
anything we?
say again?
Is that anything we've discussed? If we could look at private sector money, or is that something that would be against what we're about?
Well, I don't think it has. We have not discussed it. We
Okay.
went over the charter at the beginning of the year. We should do so again next year because the private.
Okay, I'd like to earmark that, Marvin, if we don't have to discuss it now, but it's earmarked out for future agenda item, please. Thank you.
Yep.
Are there any other questions, comments, concerns in regards to this application or how we can improve it?
I think you did a great job. I make a motion that we accept it with the changes that Lee's brought out. Gender friendly, gender neutral.
I guess, is there suggestions on how we would be specific in asking that question where it's not deemed as harmful or offensive?
Yeah, I think that I'm a little like on the fence, because like for example, like if we're asking folks race, like that is something that could be like kind of like dangerous to like put on like a standard job application. So I understand that like a board is way different than like a standard job. So I think like if before we ask the demographic questions, we put like a disclaimer that says that like the KCRHA is like seeking membership like from folks like from diverse backgrounds to accurately like represent like lived experience within our vast community. I think like a disclaimer like that would be great before like an optional question of like, are you a member of the LGBTQ plus community? And then like gender orientation and race boxes or whatever.
No, I
Or
think
even
that's
more,
give them a,
or
like
even
a
more,
formal-
Lise. We could just say, have a spot, if we're gonna keep it as is, a spot that says prefer not to answer. I've seen applications where it says I prefer not to answer. What's your
Well,
background?
I mean, if it
What's your-
says like optional, then I feel like that is already not answering it would be an option.
Yeah, and I feel like I mean, we have to ask those questions because like Liz said, like we're trying to capture those people. Those are the people that we want to bring in. And so somehow we have to be able to specifically ask that, whether it's a disclaimer or changing the wording of our question, just letting them know like, hey, we're specifically looking for these categories of people to be inclusive. They are not represented currently. And that's what we're seeking. So yeah.
One thing that's worked for me as, as a housing advocate is just asking people how they identify. So one of the questions that we have on our intake form is, how do you identify racially? Or how do you identify in terms of your gender? Or sometimes to let the person self-identify, it puts the power back in their hands and allows them to just, it teaches us
That's a great idea.
how to interact and communicate with them. So maybe just asking people directly, how do you identify? Because we're not putting limitations on them.
That's great. That's a good idea,
Alternatively,
Paula.
I think that we could have a checkbox that's like, are you able to speak to these experiences? And then one of them could be like trans experience, queer experience, and then like racial justice and things like that.
No, that's a great, I love how you worded that. Can you say that again, just so we can make sure we capture that? Sorry.
Yeah. Are you able to speak to these topics from a place of lived experience?
And then we could just list them out then, right?
For sure. And then maybe like a line like after each box that's just like elaborate like if you want to, or whatever, or like optional, like share what that means for you or things like that. I don't know, because like I think that if somebody's like, oh, I can speak to like racial equity, like I think that like an Asian person's experience is going to be way different than like a Black or brown person's experience. So I want to like leave space for folks to share like what they are bringing to the table without like, I don't know, because like whenever we thought of like the question about like just straight up asking if they're trans, I think that like outing yourself can like be unsafe in some situations, but at the same time, like if you aren't like in a place where you are comfortable like being out as a transgender person, then I like am hesitant about somebody's like ability to contribute to this work and like actively speak to the trans experience. So that's where I'm kind of on the
Still
fence.
not being able to be their authentic self, right? And that can damper one's spirit where they're at work, right? That's their own the stigma as well as the internal biases, right? And the unsure and those fears, those are really real. So thank you for that. I appreciate your perspective on that because you're like spot on. So thank you.
Yeah, thanks.
Any other questions, comments, or concerns in regards to this one?
Call for the vote.
What are you asking?
Before we call for a vote, I think that I would feel uncomfortable voting without seeing like exactly like what we are putting out there. So I think unless we like specifically draft this out now or like have it drafted before the next meeting, I don't think that I can vote yes on this.
Anybody else? Catherine, when is our next meeting?
Next
Liz?
regular meeting will be on Wednesday, December 7th, 2 to 4 p.m.
Yep.
Hey, a
Is
question
that
for Liz.
possible to have this form updated for that, and then we can place that on the agenda to vote on the updated application?
I'm sure that can happen. It's
have
just
the
a
exact
matter
wording
of
from
updating
Liz?
that language.
Okay. I'd like to do that. Just in this case, it's a little bit more detailed than what we've asked the SBC committee to update on theirs. And so just with us having the ideas of like a disclaimer and kind of changing up that identification question, I think it's just best I would agree that we just hold off. Let's update that, reissue it out to our members and the public, how that needs to do, and then just be prepared on the 7th. And the reason why I'm asking for the 7th for that to be done again is because I do want to stick to our timeline and have these up and ready. So after the new year, we can really just start digging into the process of getting everybody on the board, doing those types of things
Boards,
in a timely manner.
boards. We can have fully staffed boards. What a Christmas
Yeah.
present.
Yeah.
Did you guys decide on the party yet, Marvin and Shanae?
For our retreat, is that what you're referring to?
Yes.
So the dates are kind of screwed, to be honest. I mean, we're damned if we're due and we're damned if we don't at this point with the holidays and people being on sabbaticals and vacations and such. So we're going to issue out the 2 options that we have. And as you see today, they show. If not, then we're still going to have to move forward, right? Our work cannot stop because others cannot be present or unable to at that time. And so we have to keep this train moving. And
Okay, you're putting those dates out today, you said, Shanae?
well, I'd have to verify with Catherine on what day those were again, but I
Okay,
think
but you have
decided, and
settled
so
on
she'll
something.
update.
Okay.
Yeah, we
I
have
just-
a couple of choices, right?
Okay, cool.
Trying
All
again
right.
to be equitable and try to capture as most people as we can.
Okay.
And I want to just add that the dates are in January, folks.
Oh, good. Okay, better
They're in
sales.
January. We heard the board at the
Thank
last
you.
meeting. And we're
Thank you,
trying to
Marvin.
select dates that'll work for everybody returning and
You
hopefully
heard
to
Cranky
welcome in some
Christie.
new folks. All right.
Yes. For you folks, yeah. Thank you. I'm banging my spoon now.
The other update, so we're gonna pause on this application. We'll update it and then issue it back out with the revised meet of people who've commented today. The other thing I just wanted to drop a note on is, let me find my note so I'm not messing nothing up here. 1 second. The notes were approved for our October 5th. Was that the right one? October 5th meeting? No, that is not it. Yeah, I guess it is. They were moved, so those will be if not already posted and done on the website. And then let me find this other one.
Shanae, so final notes have been posted, or excuse me. We will vote on those October 5th and 14th notes at the December 7th meeting. regular meeting.
For that.
So I hate to muddy the water any. October 5th and 14th meetings were accepted at our November meeting. November meeting notes will be for the regular meeting, and this meeting will be voted on the December 7th at the December 7th meeting.
Thank you, Marvin. That's what I meant.
I'm sure. Just for clarity.
No, it's good. So I just want to update you guys too. So me and Marvin had the pleasure of meeting with the CSH, and that stands for, yep. What does that stand for, Marvin? What is that?
I'm not sure what CH, I don't understand. I didn't jot down their full organization they work with, but they are a HUD consultant. They generally build their
basically
work.
these three people came to us and
Yes.
were like, hey, we're here to provide technical assistance. What is that going to look like? What do you guys need from us? And I was kind of thrown off about the conversation, like, technical assistance, what are you talking about? So then they kind of broke it down for us on what that meant. And basically this team of three people are going to come on board and be able to talk to us in regards to our concerns, what our powers are, what our what our abilities are, what, really get into some of those questions that we've always asked, trying to empower us and let us know like, hey, these are the things you guys should be doing. So we can stop feeling like we're just here filling the box and checking the boxes for KCRHA.
Where did they come from? Who sent them? How
Hold
did we
on,
get
I'm
them?
trying to find that email, Mark. Do you have that one that she just issued out to us? I can't find the note one.
Can you pass that email on to us, Janae?
Well, I was going to pass along our initial discussions. It just didn't, we didn't get it till today. So we will get that out to everyone. Let's see if I can find it real quick.
That's
Each
what I was trying
individual-
to do. I can't get here.
Continue
Okay.
to look. I'm looking too. It
Okay,
is,
thank you.
they're not from one place. They work remotely. And one's from
But they work
Detroit,
for
one's
HUD.
from DC, but they all work for HUD. And they will be boots on the ground working with us starting December 7th.
How did they happen to appear?
We
Were they
asked,
asked for? Did somebody on this board ask for them?
we asked,
Who was that and how did that come about?
we
What did we
asked,
ask?
we asked for
Specifically,
technical
did we-
assistance. We asked for technical assistance. We felt, we took everything from our workshop sessions of every concern that we had, all of the problems we were having as being an informed communicative board, and we asked for assistance and, fixing many of those problems.
And they send you somebody from HUD and not from KACRHA locally?
So they're not
Because-
from HUD. They're just contracted through HUD. They do
Correct.
not work for HUD themselves.
Nor the
Okay,
case.
so,
They are
so it's like
contracted
an
through HUD
arbitration,
to
arbitration.
deliver
type people?
the goods.
So Christy, not
Interesting.
to be confused of anything, I don't know what it's going to look like,
Okay,
but the opportunity is there for us to learn together. And maybe take use of some assistance in making us what we want to be.
there you go. Are they here for a limited amount of time? Will they be on our board meetings? Do we gonna meet with them separately? What's the agenda? Do we have that yet, or is that still work in progress?
So, yep,
We-
I got it here. I found the email. So
Thank you.
If,
they
thank you. If you
are,
want, if you could
they-
send those out to us, we can read them offline. I'd prefer
yeah,
to read
I
that
still want to
offline.
review
Thank
it a
you.
little bit here though.
Okay,
Um,
thanks, Shanae. Thanks, Marvin.
So the King County Regional Homeless Authority support from CSH, again, I am sorry, I do not know what the hell the CSH is. But the point is that me and Marvin met with these people, right? And kind of told them, again, the questions, comments, and concerns that we've heard from day one from our members here on the board, as well as community. There are 3 identified areas that HUD said they are able to assist us with. And those 3 areas are governance of the continuum of care, capacity building for HUD-funded organizations, and coordinated entry. And so when me and Marvin met with them, those were the hot topics once we cleared up what tech issues was. And so they've given us a plan and some suggestions based of what we've shared with them. Again, this came from your guys' feedback telling us like, we're not heard, we're just checking the boxes, the transparency, the power that we hold, like what is that? The fact that, again, we're not getting documentation or review time to do our job properly. And so I'll issue out the details like Christy's asked, but just an overview. They have under governance of continuum of care that they will assist us and staff to understand their roles and responsibilities as outlined by HUD, develop ways to measure how their system is performing overall in addressing and ending homelessness, develop a clear and transparent funding allocation process, and assist them with setting up the COC work groups and committees to oversee the operations, system performance, and coordinated entry. Some of the places that they'd like to start, and these are just ideas, nothing is finalized, is the COC staff training, COC rules and responsibilities that will be developed, system performance transparency, funding and resources, allocation processes, and priorities are developed. So that's all covered under the first topic of governance of the continuum of care. The second piece they said they could help us with is capacity building for the COC funded organizations. They will work with the board and staff to provide organizations in King County that receive HUD COC funds. The proposal is that the support will focus on the following areas. Building KCRHA capacity to provide grant administration training to local organizations, including supporting the lead timeline for project application processes, specifically and typically called NOFOs. Support the KCRHA to host, I think we need to change some of this wording too, just to let you know. Effective project application workshops for each NOFO posted by HUD. They are hoping to train their community to understand, or our community to understand, key HUD systems and tools. And they give examples of LOCCS. I don't know what that is. These are just acronyms they put in here: SAGE and eSNAPs, and HUD monitoring requirements and preparation.
It's time to adjourn. Yeah, I'm losing my focus here.
Oh,
So I'm
sorry.
wondering if you can- No, that's okay. I appreciate you wanting to go over this, but it's after 4. It's
Oh, I
6
didn't
o'clock.
realize my time. My bad. You got to
Yeah,
get me on the
yeah.
time frame, y'all.
I
Well, the
couldn't
point is,
interrupt
we'll
you.
email these out. I would encourage you
Great,
guys
thank
to
you.
please review it in detail, right? Because like I already said,
Yes. I want to thank everyone for coming today. We have reached,
Excellent.
and we will get out information and share more this upcoming week, and look forward to seeing everybody on December 7th. Please enjoy your holidays.
thanks for showing up and showing out, you guys. I see you. I appreciate you. Have a good week.
Adios, amigos.
Thanks, everybody.